I don't. I mean, I don't feel well. I feel very nauseous. And I'm so dizzy. Oh no, I am so dizzy and nauseous. I don't know.
Excuse me, I couldn't help but overhear you talking to your husband. Do you mind if I perform the fast screen on you? I will have you smile for me. Can you give me a big smile? Okay. A little bit of drooping on this side. Can you hold your arms out straight for me? Have you hold them out straight in front of you with the left arm? Okay. A little more weak on that left side. How about, can you talk? Okay. Can you talk for me? Okay.
I have Isabel.
Yeah, a little bit slurred there. Okay. Do you mind, I think it'd be good for us to call an ambulance. Is that okay?
Okay.
Okay. I think you might be having a stroke. So I'm gonna have someone, could I have someone call 911 for me? And I'll stay with you. I'll stay with you and
nauseous.
you're feeling nauseous. Okay.
I feel nauseous and I'm dizzy.
Okay. Any headache at all?
Headache, and I'm so warm.
Yeah.
I'm warm.
Okay.
A stroke?
Your symptoms came on pretty fast?
Yes.
Importantly, get there as soon as possible. You'll be okay. Yes.
Oh, what's going on today? I think your man had a stroke. Okay. You're nauseous? Okay. Any medicine? You want to get a blood pressure for me, John? When did all this start, sir? Just now. Just now? Okay. But was feeling fine and everything today? Right. Okay. All right. Few bumps here getting in. We're good to go to the hospital. Sure.
Hey guys, what's going on?
53-year-old female, left-sided weakness. Started less than a half hour ago. Also with nausea and dizziness. Did have weakness with the grip as well as facial droop.
Remember on 3. 1, 2, 3.
As well as some trouble speaking.
Hi, Carolyn. I'm going to put you on our monitor.
Hi, Monterey. How are we doing today?
Hi.
All right. What do we have here? What's going on?
This is Carolyn, and she's having some left-sided weakness with facial droop. She does have some slurred speech. I
Okay.
believe it started about 30 minutes ago.
Okay. Have we
And
taken a blood sugar yet?
We have. EMS got it, and it was 88.
88. Okay. New
Yeah.
onset slurred speech and left-sided weakness. Carolyn, can you smile for me, please? Thank you. Okay. Can you raise up your arms for me like this? All right. Very good. How about that left side? A little bit. Okay. You can relax now. Can you say hi? Hi. Okay. So we have new onset slurred speech, left-sided weakness, blood sugar to 88, new onset about 30 minutes ago. So I agree that we're potentially having a stroke here. Let's call a stroke alert overhead. Consult Dr. Rosen via telemedicine.
Call 6-3.
Stand line. Confirm.
Hello, I need to call a stroke alert.
Okay.
I'm in trauma room A in the new ER.
Okay.
Thank you.
Your attention please. Stroke alert in the new ED, trauma room A. Stroke alert, the new ED, trauma room A. Stroke alert, the new ED, trauma room A.
Carolyn, we're back in the emergency room.
Okay.
Let me put her head up a little.
Raise the head of the head up about 30 degrees.
Okay, that's fine. Okay.
This is Carolyn, Dr. Rosen.
Okay, thank you.
She's had some left-sided weakness and facial droop and slurred speech for about 30 minutes.
Carolyn, good morning. This is Dr. Rosen. I'm a neurologist. I've been asked to come see you. How are you feeling?
Nauseous,
Feeling
dizzy.
nauseous? When did this all start?
She, about a half an hour before she got here, and she's been in the ER about 15 minutes, so approximately 45 minutes ago.
So 45 minutes ago. And what kind of symptoms did you have when it started?
I had a headache and I was dizzy and nauseous.
Okay. Do you have any weakness anyplace?
On my left side,
Okay. Do you have high blood pressure? Any heart problems or diabetes? Okay. Are the symptoms changing? Have they gotten any better or any worse since they began?
no change.
No, they're about the same? Okay. Let me check a couple of things now. I want you to look right at the camera, and without moving your head, open your eyes wide, open your eyes, and look over to your right. Okay, good. Hold it there. Now look to your left. Look over to your left. Okay, very good. Okay, let me see you smile. Okay, very good. Okay, let's see a couple other things. Let's take the pulse oximeter off her hand. It's on. Okay, so hold up your right arm. Okay, how about the left one also? Okay, that's good. Let's take a look at her feet. Pick up your right foot, your right leg. Very good. How about your left one now? Okay, that's good. With a broken Q-tip, let's check for pain sensation on her arms.
Okay, over here and over here. Is there any difference?
I don't feel my left.
She doesn't feel on her left.
Okay, let's try it over her face.
Is there any difference?
No, feel on my left.
Again, no sensation on the left.
Okay, let's check the carotids with the stethoscope.
Okay, we're just going to place this on your neck, honey.
Okay, now on the other side. Okay, that's good. All right. Now, do you take any blood thinning medication? No. Have you had any surgery recently? Any head injuries?
No.
No. Have you had any bleeding from anywhere?
No.
No. Okay. I looked at the CT scan before I logged on, and it looks okay. There's no bleeding in your head. So it appears as though you've had a stroke due to a blood vessel that closed off. And we can treat that in some people, not in everybody, with medication that dissolves the blood clot. It works fairly well in some of the patients, not everyone. The downside is that in 5% or less of patients that receive the medication, they can have a hemorrhage in the area of the stroke and they get worse. So you have to decide whether the risk will the benefits outweigh the risk? Do you want to get the medication?
Yes.
Okay, fine, all right. So nurse, we can start mixing the TTA.
Okay.
Stroke affects 800,000 people annually. Every 40 seconds, someone in the United States suffers a stroke, and every 4 minutes, someone dies from a stroke. 87% of all strokes are caused by a blood clot in the brain. That blood clot can be treated medically by a medication called alteplase, otherwise known as TPA, if the stroke victim arrives to the emergency department within 3 hours of symptom onset. Time is the most important factor when a stroke occurs, so it's important to think fast. F stands for face. Ask the person to smile. Is it equal on both sides? A stands for arms. Ask them to raise their arms up. Are they able to, or are they weaker on one side? S stands for speech. Is their speech clear, or is it slurred? And then T stands for time. If you think you or someone you know is having a stroke, call 911. Stroke is an emergency.